Hi, I'm Dr. Suzie from Taylor Clinic, and joining me today I've got Dr. Bao. Now, Dr. Bao is going to be talking to us today about thread lifting, which is probably the hottest thing to hit Sydney at the moment. It's essentially a non-surgical procedure, but to tell me more, I have the master of thread lifting here with me. So tell us and tell the audience today, what exactly is all this thread lifting about?
Well, in summary, a thread lift is basically using an organic material made into a thread, which then lifts sagging tissues that occur as a product of aging.
So it's basically a facelift.
Pretty much. And the best part about a thread lift is that there's no cutting, there's no stitching, and there's minimal downtime. Patients can walk out of the clinic after the procedure is done with minimal interruption to their lives.
So basically, this is why they're calling it the lunchtime facelift, because you can essentially walk into a cosmetic doctor, have a procedure which doesn't involve any surgery, essentially, it's just an in-office procedure, and walk out with a lifted face. So what areas can you thread lift? What's the best areas that people can be actually lifting?
Well, typically a thread lift could be used to really lift the cheeks and ease the shadow of these smile lines that everyone complains about that just don't seem to respond well to filler and Botox. It can correct the line of the jaw by lifting the jowls that happen as a result of aging.
Yeah.
But there's other uses for that as well. Some people, as they age, they complain about a droopy eyelid.
Yeah.
And threads can be used there, and they can be used to lift the sagging neck. And
Wow.
even in Europe,
Yeah.
there's talks of lifting, sagging breasts.
Yeah, I've heard about that. The breast lift with threads. So basically, what you're saying is, as an alternative to a surgical facelift, you can actually do eye lifts. You can do mid face, jowl, and neck. Essentially,
Correct.
Wow. Okay,
Yep.
cool. So there's a lot of Australians out there who have used filler and Botox. They've done all that sort of stuff, and personally, I've tried those things, and particularly with filler, I've found. With the mid-face area and the cheeks and around the mid-face, that if you provide too much volume, that sometimes you can start to get a bit of this chipmunky type look. Is that right?
Yeah.
That's not what I'm trying to say.
No, that's good. That's good.
Is that
So,
right?
yeah, that's
Is that
good.
what
Yeah, you can
happens?
say it. Yeah,
Yeah,
you can say
okay,
it looks
yeah.
chipmunky. Yeah.
So you start to look quite full. How is this different to filler and Botox? What is it? How is it doing it differently?
Well, pretty much, Botox, as we all know, is used to treat fine wrinkles and fine lines when the muscles are moving. Now, everyone talks about filler creating lift, but the actual primary use of filler is to fill the loss of volume in the face.
So could it actually be promoting a drop later on? Is that
Could it promote a
Yeah.
drop? Well, the answer is no, because what happens with these threads is rather than lift through volume, what it addresses in the aging face is the fact that the tissue itself is looser. And so the way the threads are designed is that they compress and bring tightness back into the tissue once they're placed. And as they sort of slowly dissolve in the body, they stimulate collagen around that loose tissue to create a little bit of a collagen scaffold. So will there be a drop? Sure, it's definitely not as much of a lift as when the threads were there, but to say that your face is just going to fall down back to where it was, definitely not, because of that increased collagen that's being made.
And so how long does a thread last for?
Well, the thread itself lasts up to 18 months in the face, but you have to remember there's all the collagen that's being made throughout the tissue while it's being there. So there are some sort of value added effects that are down the line even after the threads are gone.
Right. So the thread itself is going to give a lift, and what you're saying is it also promotes and stimulates the collagen anyway. And I suppose from the period of 18 months not having that lift or not having that gravity making it go down, do you think it's preventative in some respect to, aging?
Well, I think everything that we have nowadays with regards to cosmetic procedures do have a preventative effect.
Oh, I agree with that.
It's well proven that if you ease the action of the muscles with Botox, you reduce the appearance of fine lines. With fillers, you get a bit of a collagen stimulating effect. And this is no different as well. When you use these little small procedures over time, you could potentially delay the need for a drastic facelift when it's too late.
Well, that's going to be my reason for getting it done today.
Oh, excellent.
So,
I love it.
Dr. Bears, kindly going to be performing a thread lift for me, and he will be doing my jowl area. So even though, you know, I probably don't have a huge amount of drop there right now, A, I want to see how much lift I can get, and B, I figure that if I can get any lift right now, it's obviously going to be preventing, you know, me requiring anything else in the future. So given that I'm going to have the procedure, I want to ask a couple of little questions relating to the procedure.
Absolutely.
Okay, so you've told me so far it's going to be about an hour, and that there's probably not going to be much downtime apart from some mild bruising. Is that correct?
Well, see, in the 50-odd procedures that I've done so far, I've probably had bruising in only about 2 cases. So, you know, to say that you won't bruise, I can't overpromise and underdevelop.
I tell patients myself, anytime a needle or anything's going to go near you, you run a risk of bruising. So that's an obvious one.
Yeah.
Is there any other major side effects that I should be aware of with the thread lift?
You know, as with any sort of cosmetic procedure where we're going through the skin, you know, there is a chance of infection.
Yep.
And to do that, you know, we're going to be doing everything under sterile conditions today.
Yep.
So the chances of, you know, infection are quite minimal.
Yep.
I always give my patients prophylactic antibiotics after the procedure just to minimize.
Make sure.
Yep, pretty much any risk.
And the most important question I want to ask, will this thread actually snap?
The answer is yes, any thread can snap, but what's amazing about the Silhouette Soft thread is because it's non-permanent and your body is breaking it down, you don't need to remove the thread surgically like the barbed threads that you may have seen on a Google search of, you know, all these other threads that are out there. There's just no need for that. It can just sit in there and stimulate collagen, and if we have to bring that lift again, we can just put another thread in under an hour.
So you just leave it in there?
You just leave it in there, and it's not doing anything.
Does it eventually break down? You said it was an organic material.
Yeah,
anyway.
it does. Okay. It breaks down on its own, so you don't need to do anything about it, and it just makes collagen while it's sitting there.
Okay, cool. So if it does snap, I might look a little bit like that.
That's all right. We'll fix you up in a month. It's all good. Don't worry about it.
Just kidding. All right, cool.
Yeah.
Well, I'm looking forward to having this procedure.
So as we discussed before, we are going to do the markup of the procedure. If I'm just coming through here, what I've done here is mark where the entry point of the thread will be. Now the thread is guided by 2 needles, one on each end of the thread. And this entry point, I'll have one entering all the way along the jaw and exiting here, so that when the cones engage, they'll create a lift backwards like this. Now, on the other side of the thread, I will guide it all the way up along here, just past the ear, and just right below the temple here. And what that will do is create an upward lift as well, but also anchors the thread in place. Now, traditionally, what they have taught us with Silhouette Soft is that we enter right here on the angle of the jaw here. I've been playing around with this, and I find that with the bunching, that will naturally resolve in a week. People get a much better result if that's hidden behind this natural groove behind the jaw. So I'm just going to mark it on the other side as well. Now, the way the threads work, and I'm just pulling up my iPhone ruler here. Now the way the threads work is that the threads have cones along the middle part, and then they have no cones at the end. And the idea is to drag as much tissue as possible over to the cones. And to do that, I need adequate distance between the last cone and the exit point of my needle. So here I thought initially I'd mark it here just behind, about 2 centimeters behind the jaw. Now that's a little bit high, and that doesn't give me any sort of area to move upwards. I'd have to sort of curve it around the ear, so that's not a good marking point. What I am going to do is lower it so that I can still create a straight line along the jaw. And if I measure with my ruler here, with the cone we're using, we're going to need about 9 centimeters of space. Now I'm just going to give it a little bit of extra space after the last cone to give ourselves as much lift as possible by going at the 10 centimeter mark. And same thing up here. Now up here, I'm not too concerned with lifting upwards. The lift is primarily here. All the cones on this side are basically used as anchorage. So I'm not too concerned about maximizing the full distance but after the last cone. So I'm just going to stick to the 9, and I'm going to leave my point roughly around there. Afterwards, what I'm going to do then is at every one of these points, I'm going to inject local anesthetic. Now this might sting a little bit for Suzie, so I do apologize beforehand. She's got the gas in her hand. She's ready to go. All right. Okay. All right, so Susie's had a few puffs of the gas. No, I'm kidding. She has
Ready to go.
to put herself at ease, and now I'm going to go in with the anesthetic. The anesthetic I'm using is xylocaine with adrenaline. What the adrenaline does is it helps close off the little blood vessels so that we can control bleeding as much as possible, seeing as we are doing this in an office, and less bleeding, well, naturally better.
Means that the cameraman won't faint.
That too, that too. All right, Suze, a little bit of a sting, okay? Coming in. There we go.
Yeah, it's a little bit of a sting, but
Yeah.
it's nothing.
And so, you know, you might be wondering, well, Bao, you've just kind of wiped off your marks. How do you know where to exit or enter? And this is where the adrenaline comes in again. When the adrenaline causes a little bit of a constriction in the blood vessels, you're going to see these pale dots here. So I know exactly where I've marked, not only with the pen, but also with the adrenaline. And another puff of gas. Yeah, it's a bit sensitive, isn't there? Sorry, Suze, you're doing great. All right, and the other side. Halfway there. We're doing well. Yep. Okay. Okay. All right, and that's all the anesthetic that we'll be using for this procedure. So in essence, there's a couple of pieces of equipment that you will need. You won't need any sutures or any scalpels. What you will need, however, is a sterile drape to keep infection control measures. You will need chlorhexidine, a dressing pack to keep a sterile area, some sterile gauze, and you'll need some sterile scissors, as well as a sharp 18 gauge needle to create your entry point. A 19 gauge needle will not suffice, as it is just not big enough to allow the cones to pass through into the skin, and you may snap your thread in the process. Be very precise with the instruments that you use. You will also need a pair of sterile gloves for this procedure. Depending on the type of drape you might be using, you might need to cut an additional larger hole around the area, as it needs to accommodate the full length of the pass-through that you're going to be doing with the needle. Now that I've got my sterile gloves on and I'm scrubbed up, I can happily just work with my sterile instruments and just basically cut a bit of a hole like a Martha Stewart show.
I'm increasingly getting more and more retarded.
Yep, that's good. That's good.
That's what you're meant to do.
Yeah, exactly. All right. Okay. Can we get a close-up of the threads? Just get a close-up. Yeah. So what do the threads themselves look like? As I'm opening up this package, you can see that there are 2 threads in here. Be careful not to bend the actual tip of the needle, as that will affect your ability to pass through tissues accurately. Now, I don't know if you can see this, but you've got 2 needles, which help guide through the subcut tissue. But you've also got this thin, try not to get close to, this thin lactic acid thread. Now I'm tugging on this pretty hard, so it's a very strong and very sturdy material that's been made out of lactic acid, the same stuff that makes your muscles sore after a hard workout. On there you can see small cones. The cones there will engage the subcutaneous tissue and create that lift through compression. As you can see, we're going to be angling it today in L and creating compression backwards and upwards. Be careful as you're about to use it to actually engage the knots in the thread, as the knots do come loose. And so all you need is just a simple tug, and that engages the knots, which secure the cones in place. I'm going to clean your face, and at this point, Suzie, you're not allowed to touch your face. If you have an itchy nose, tell me and I will scratch your nose.
Got ya.
All right. You'd be surprised how many patients don't know that, and they're just like touching their nose and like playing around with the drape. And then you're just like, oh, you ruined my work.
Oh, it's so numb.
So numb, hey?
Numb.
Yeah. I'll clean that one up afterwards. Oh, is there a bin around here? Sorry. Now that Suzie's face has been sterilized, I'm now just going to put the drape over Suzie's face, starting with the side that I'm going to work on first, just as an infection control method. Here we go. All right, Suze, this might get a little bit claustrophobic, so I'm just going to talk you through it. All right. Just going to bring Suzie up a bit so that I don't hurt my back. It's very important not to hurt your back during this.
Am I going up?
You are totally going up.
Okay. Not sure.
All right, and Suze, if you could give me a tilt that way. Yep, perfect. Thanks, Suze. All right. All right, so for my entry point, I'm going to be using an 18 gauge needle as my starting entry point. Suze, can you give me a bit more of a tilt to the side, please? Thank you. Once again, just going to clean the area once more. Now, if I've done this part right, Suzie shouldn't feel anything as the needle's going in. Can you feel any sharp, Suzie?
Obviously not.
Okay, good. I've done my job correctly. All right. It's important to give it a bit of a swivel so that you sort of get an angle on all the subcut tissue and the connective tissue there so that you can thread through faster. And then you pull it out. Now, as you can see, with this big of a needle and the amount of adrenaline with xylocaine that we put in, she's got no bleeding after the fact, which is good. And that's what we want. All right. Now on the needle, as you can see, there's a little black spot to indicate how deep under the skin that you need to go. It's a very fine dot, but you want to get just under the dermis and just in that thin layer of fat between muscle and dermis. And that way you have enough tissue for the cones to hook onto. So going in and perpendicular to the skin, I'm going to go through there, twist in. Can you feel anything, Suze?
No.
Excellent. Are you being honest?
Yeah, I
Excellent.
can't feel anything.
Excellent.
Am I meant to?
No. Thank God. All right. Now the difficulty with this placement is I need to overcome the curvature here, which means I need to do some selective playing around with moving the skin around and the subcut tissue. And to do that, I'll simply pinch up to create space and thread forward. Now I'm going to rely on Suzie's feedback here. If she feels a dull ache, it means that I'm too deep and I'm hitting the muscle layer. If I'm too superficial, it means that my needle is scraping the dermis and it'll feel sharp. So Suze, let me know what you feel.
Nothing.
Excellent. And I'm going to check in on you regularly, Suzie, okay? Can you feel anything, Suze?
Mm-mm.
Excellent. So what you want to do is pinch the skin to create extra space between the dermis and the underlying muscle and stretch out that fat layer. Can you feel anything, Suze?
No.
And the best way to tell is if we can have a zoom up of this area here. Yeah. If you move the needle, there's no tethering of the skin itself. The needle can move freely. That means we're in the right plane for the cones to work. If we're too superficial, we'll see tethering and tension lines along the skin. That means we need to pull back, readjust, and try again. Can you feel anything, Suze?
Mm-mm.
Excellent. How are you feeling?
Good.
Good? You're doing really well, Suze.
Mm-hmm.
How you doing, Suze?
Mm-hmm.
Doing well?
Mm-hmm.
It's just a bit of a weird pressure, isn't it?
It's just just a pressure.
Yeah. We're about halfway through our first pass. I like to update my patients as I'm doing the threads. How are we doing, Suze?
A little bit sharp.
Okay. So sharp is a good...
touch.
Yeah, just a touch. So one of the big challenges of working with this is you've got a straight needle that's curving toward, that's working on a curved surface such as the face. You want to make sure you're pinching adequately at all times. How are we doing now? Any pain?
Yeah, a little bit sharp, but nothing much, nothing else.
Okay,
No
all right. We're actually almost to the end of our pass-through. How about now?
Sharp.
Sharp? Okay. How about now?
Nothing.
Nothing? Okay. Okay. Can we zoom in on this bit here? Yeah. Okay. So one of the difficulties is skin can actually be quite thick on the skin. And so a technique that I've learned to facilitate getting the needle through the skin is to simply use the plastic cap of my 18 gauge needle, put it flush against where I can see the needle will enter, and that creates a little bit of a sort of, I don't know, it just kind of helps really push the needle through like so. Did you feel any of that?
No, what happened?
I got the first passes through.
Oh, wow.
Yep.
Am I halfway done?
No, you're about 25% done.
Oh, cool.
Yeah. So now, Suzie, what's going to happen is the cones are going to go in and you're going to feel like there's rice bubbles in your cheeks.
Yeah, I feel weird.
You feel weird. It's about to get a lot more weird. You ready? 1, 2, 3. Did you feel that?
Yeah, but I don't know what it feels like.
Rice bubbles.
Okay, rice
All
bubbles.
right. So now that we're done with this and with this pass, we're going to cut the needle off so that we don't hurt Suzie accidentally. Like so. We'll leave that thread there because we'll need to pull on that later to create the actual lift. We've simply been positioning the threads up to this point. So once again, going into the same hole that we created earlier, right down to the 5 millimeter mark, which puts us just on the dermis. Now here can be a little bit tricky depending on how long a person's neck is. There's a lot of ways around this. What I'm going to do is, because my hand is now sort of hitting Suzie's collarbone here, what I'm going to do is create space with the head. And this is one of the advantages of doing things while people are actually awake. Suzie, can you give me a chin tilt down? And that now gives me a lot more space to play around with my hands. Can you feel anything, Suze?
No.
Excellent. Thank you for volunteering yourself for this educational video.
I'm the winner.
Are you? Free thread?
Mm-hmm.
Okay. Any pain, Suze?
Mm-mm.
Excellent. Now there's a lot of thick fascia around here, and it can definitely it can definitely require a lot of pressure to push through. How are you feeling, Suze? Now along this track, you may hit the facial nerve based on the anatomy. Typically, it just comes off as like a slight burning sensation, but that's all transient. It's important to hear your patient's feedback during this phase. How are you doing, Suze?
Mm-hmm.
How are we doing, Suze?
Mm-hmm.
Yeah. How are we doing, Suze?
Mm-hmm.
Good. Check in regularly with how they're feeling. Don't try and brute force the needle through. How are we doing, Suze?
Mm-hmm.
Yep. Okay.
I'm not feeling anything. Just so you know.
'Cause I'm good.
Yeah. I know. I honestly haven't felt anything really yet at all. I'm really curious to see what the hell you're doing.
Second pass can be a bit problematic because we're going through the same hole and there's a little bit of a looping in the cones and the threads. It's important not to brute force it. There should be a little bit of gentle tension to try and get things through, but as always, if you're not making progress in getting the cones through, you should probably play around and twist around the cones. In our next series, we'll go into how to troubleshoot sticky situations with cones. So right now, we've got a little bit of an issue in terms of getting it in. That's okay, Suzie. There are ways to get around it. Sometimes it just means that the subcut tissue isn't quite opened in that direction enough from our initial swizzle. It is okay to take your 18 gauge needle back in and create a bit more laxity in the subcut tissue, and it will not damage the thread. How are you feeling, Suze?
Good. How's it going?
It's good. It's just a little bit stubborn right now, but we're doing just fine. This happens quite commonly sometimes. You just have to loosen it up a bit, but we're all good, Suze.
Okay. Is that you, Toby?
That is her.
Don't make him nervous.
Job's on the line. There we are. How are you feeling, Suze? Any pain?
Nothing.
Excellent. All right. Well, Suze, we're actually halfway done. Yep. So now what I'm going to do is lift up and have you turn the other cheek.
Yep.
Excellent.
Oh, nice to go the other way.
I know, right? It's amazing. Big relaxation. So again, we can see the white spot even several minutes later of where we've entered because the adrenaline has done a good job of closing off the blood vessels. Now, one of the issues with threads and keeping it clean and within the sterile field is that threads can go their own way and sort of have their own mind and flip around. A way to secure the thread in the absence of any assistance is to simply put the needle through a piece of gauze where it'll simply rest, and then, no matter what I'm doing, it'll stay in place. Small life hacks. Now once again, going over the angle of the mandible. How are we feeling, Suze?
Nothing.
Excellent.
Be a little bit sharp. Just
A little bit sharp? Okay. Give me a bit of a tilt up, actually, this time. Thanks, Suze. How are we feeling, Suze?
No, good.
Good. How are we feeling, Suze? How are we feeling, Suze?
Just a touch of,
Sharp or
yeah,
dull?
just a sharp.
Okay. Overall, how would you rate this experience compared to fillers and the pain that you get from that? If you had to be honest.
Look, to be honest,
Yeah.
I think that apart from the local anaesthetic,
Yeah.
this is nothing. This is actually less painful than the filler.
Mm. I think probably the most distressing.
This is nothing. I mean, literally, I just feel like you're holding my face and pinching the skin. That's it.
Yeah. I think the most distressing part of this is really just having the drape over while someone else is playing around. But yeah, definitely. But by and large, it's a fairly well tolerated procedure. How are we doing, Suze? Pressure? Yeah.
No.
That's a sharp one there. And so sometimes tricky bits of having a straight needle through a round corner, you just have to sort of pull on the skin a little bit and create that extra space. And sometimes it helps if you sort of advance. Can anyone bring it around? Yep. Pinch the skin. Yep. If you can pinch the skin and direct with your index finger the tip of the needle, like so. How are we doing, Suze?
That was just nothing. I think it's fine.
Okay. We're almost through. How are we now, Suze?
Yeah, okay.
Doing okay?
Yeah.
All right. Last little bit. Sometimes the last little centimeter can be a bit tricky.
Nothing.
Nothing? Nothing?
Absolutely nothing.
Okay.
How'd you go?
Pretty good. We're almost done on this pass. There we are. Nothing?
Nothing.
Good.
Did you do it?
Yeah, we're through. Is it in yet?
We're done. I can't feel anything.
Again, more rice bubbles popping through.
All right.
You all right?
Yeah.
Just feels weird, hey?
Yeah, I can't explain that.
Yeah.
I'm trying to work out how to describe it.
Rice bubbles in your cheeks.
I don't think that quite works.
No?
No, there's something else, but I haven't put my finger on it yet.
There we go.
It feels weird.
Yeah, it feels weird. All right. Last pass through, and then once that's done, we'll get you up, and then we'll start doing the actual lifting, and that's really where the sort of weird fun bits start to happen.
I feel like there is something there though. Will that sensation go?
It disappears after about a month.
Yeah.
Yeah, and give me a bit of a head down, please. Thank you. It's very important to use your patient's movements to create as much space as possible so that you can, have an easier time working. How are we doing, Suze?
Yeah.
Doing all right? No pain?
No.
No pain?
No.
Okay, let me know.
I will.
Okay. No pain?
No.
Okay. Sorry?
Not now. I just like the crunch of something.
The crunch.
What was that?
Oh, that was me pulling the threads through.
All right.
Yep. Okay, and that's it for all the traumatic stuff.
Really? Oh, you did the top bit?
Yeah.
Just there, and that was quick.
Yeah. All right, so we're going to take the drape off. And now we can have a look at Suze. Suze has got some fishing wire, but let's...
Oh, God. Where's Toby?
Yeah.
Oh, I just touched it.
Oh, that's okay. All right, so this is where we start doing the lifting
wire
bit.
hanging out of my
All right.
face.
Now, all you need to do at this stage is literally just pull on the thread and massage backwards and watch the tissue compress. And you're going to feel popping. Do you feel that popping? Yeah? It's a bit strange, isn't it?
It's not popping. I feel a feeling of you just tugging, actually.
Yeah.
My whole face.
Yeah.
So you can control the amount of lift?
You can absolutely
Ooh.
control the amount of lift.
Are you
You
struggling
alright,
to watch
Tubbs?
me?
But you can already see that side is much more lifted compared to the other side just by
The
compressing
surgeon
it.
just went squeamish.
Cameraman is standing, but the surgeon couldn't handle it.
Toby can't handle it. Oh, hold on just a little bit.
Anything happening?
Yeah, it's amazing.
I can't see. Am I looking
No,
amazing?
you know what? Give her a mirror. Does anyone have like a
You
side?
can see one side and the other.
Yeah,
I'll
give
show
her a
you.
mirror. Give her a
I'll
mirror.
show you on my phone.
Ask Toby to get a mirror.
Hang on a second, I'll get the phone.
I just look like a Chinese person with hair coming up.
I'm gonna put some hurt on her now.
Is it this side?
Yeah, that side.
That's
We
a
pulled
different
up.
distance.
Yeah,
I
see the
can't
shadow. You
tell.
can see the
All I
shadow.
can see is this here, so I
Yeah,
can't
we'll
really
pull a
see.
bit
That's
more.
okay.
We'll pull a bit more.
Don't. I pull what's necessary. Ow.
Yep, that's it. But if you see it in the before and afters, you'll definitely see it. Like the softening. She had that round bit that was here, and that is
You can
complete.
see it. I
I
can't
can
see it right
see it,
now.
Yeah.
Yeah.
I actually was remarkable. I could.
Your face should feel tight right now.
It does.
Yeah.
Is that okay?
Yeah, that's exactly what we want. We want tight. And when we take the after, like that's why when I was saying when you guys were filming this, see the
I
round
really,
bit?
really, really am having a facelift. Do you realize?
Yeah.
This is actually a facelift.
Yeah.
Oh, it's a facelift, Tobu.
See that jowling? Like it's going and lifting up.
A bit dirty that I didn't know when she was 25 and you've helped me back.
Yeah.
I can't laugh. Ow. It's really tight.
Yeah,
Am
it's
I going
tight.
to be able
That's
to
good.
laugh?
No, don't laugh. For the next
Am I
few
going to
days.
be able to laugh?
You will be. Yeah. So you can see she had a very prominent pre-gel sulcus in the shadow, and now that's completely lifted. If we look on the side here, in the before and afters, you'll notice that like the tissue has moved roughly by about 1 to 2 centimeters up here before the jowl line started here.
Ow.
And so because everything's anchored already into the tissues underneath the skin, we simply now just need to remove the sutures. Cut flush against the skin, and it buries within. Sorry. All right. And now let's take some before and after photos.
Yeah, I can't wait to see it.
Yeah. But I've definitely made you a Kardashian.
Did you get me?
Yeah,
You get me there?
I totally got you. Made you a Kardashian.
I said, give me a Kardashian look.
Yeah. Yep. So as you can see, with no cutting and no stitches, we've really eased the jowl area here, which traditionally fillers could not have done. Now, if you notice, if we turn, Susie's got a little bit of an entry mark behind here that no one's going to see. That will disappear within a week. And that's it. We're done.
Wow.
Hi, it's Dr. Suzie again, and I have just had a 1-hour non-surgical facelift, or otherwise known as a thread lift, performed by Dr. Bao. And here with us to talk about thread lifting also is Dr. Tobias Pincock, who is our facial plastic surgeon. Now, I must say I am actually slightly have a bit of an impediment because I've still got some anaesthetic in my face. But overall, I just want to say thank you very much. That was to be a patient in that particular procedure, I must say, I was quite calm. I didn't experience any major pain apart from the local anaesthetic, which is obviously to be expected. But otherwise, it went extremely smoothly, and I can actually feel the threads at the moment in my face, and I've obviously still got numbness from the anaesthetic. The threads just feel like a slight tightening sensation, but I've been reassured that that sensation apparently will go away. Is that correct?
Yeah, so typically in around a month and a half that it becomes, barely noticeable, if at all.
And the only post-care instructions that I was given was that I had to sleep upright.
There's a couple other ones that I'll go through, namely no heavy exercise for the next 3 days.
That suits me.
You'll be fine.
Do avoid heavy massages of the face, as
Yeah.
you don't want to dislodge the cones from where they're hooking onto right now. And another important one is don't schedule any dental surgeries 3 weeks before or after the procedure, as that can increase the complication of infection.
Done.
And one of the most important things is to sleep with your head upright. Now, that doesn't mean you have to sleep in a chair. It can be as easy as putting an airplane pillow around your neck and then supporting your head with a pillow so that you're not rolling your face onto your pillow. And that's really just to protect your investment after the procedure.
Yeah,
Awesome.
they're good points, Bao, because they're the sorts of things that patients actually worry
Need,
about.
yeah.
I'm amazed at the results from such little intervention. I mean, when I started in aging face surgery, it was 2006, and really alternative to this would have been a short scar facelift or a minimally invasive facelift, which has still got 2 or 3 weeks downtime and is pretty expensive. I mean, I think nowadays with young women having access to ultrasonic therapies like the Alt therapy, to modern day fillers with at least 2 years now, much stabler than they were when they first came out. And Botox, of course, those early things like the Nefertiti lift and fillers, they've been phased out now by new technologies, and this has really fit what I think was a really lacking in our armamentarium against aging face was what to do with the jowl in someone that otherwise does not have any cervicofacial laxity. I mean, this is the answer.
And it's not only for that area as well. When people talk about these lines here that we call the nasolabial folds or the smile lines, they're probably the only product on the market that adequately addresses the laxity. Things
Also,
falling down.
the going from a chemical brow every 3 months to having, a thread as opposed to coronal or even an endoscopic lift. I mean, this is fantastic. I like the idea that they're not. I mean, threads have been around for a long time, but the cones I like because I know they give you a lot more power than just the nicks in the threads that go along. And I also like that they're dissolvable, and that's why I never got into the other threads, because they promised a semi-permanent or permanent lift. And here we know that this is 2 years, but with the additional benefit of the collagen formation giving you some long-term benefits, it's going to work well, particularly in combination with our other technologies.
Yeah, we didn't get a chance to talk about combination therapies last time, but this is a question.
That's another video, Dr. Pakir.
This is a question for Dr. Pincock. But in your opinion, with something like this, particularly for the aging face, what do you think it would work well with? Like, is there any other treatments that would be very complementary with it?
Look, to be honest, a lot of other non-surgical therapies, obviously if you look at sort of the skin, soft tissue, bone, this is really sort of putting the soft tissue back, and of course the skin is attached to that. I think it really depends on the person. I tried to sort of work out a flow chart that who was going to have this technology, but the reality is whether the patient needs skin work, and so therefore introducing them to the pico or other fractionated lasers. But on the other hand, a lot of people are well educated about skincare now, so they may not require the laser. However, they may require more lifting, so they may require more threads in different areas, or Ulthera is that works well. Cool Sculpt is another one for someone with a fat neck that wants to get it lifted. We can reduce that massive fat. All of these, even 5, 6, 7 years ago, all required fairly decent sized operation, at least 3 hours under a general anaesthesia for it to be safe. At least one overnight stay to be safe. And so really, we're talking about the ability to get results with a fraction of the investment that patients had to do.
So someone could technically, pretty much in a day, get the equivalent of a surgical facelift to the bottom half of the face by doing a cool sculpt, freezing the fat, Ulthera or Ultherapy to give a lift, and then doing a thread lift and pico with a little bit of Botox. And we're talking about an armament of non-surgical tools now that cosmetic doctors and facial plastic surgeons have when they don't need to put anyone under the.
Well, I think still there are going to.
Are you going to be out of a job?
Well, there's always trauma in those. But no, I don't. Look, there's always going to be a subset of patients that require a surgical lift, but that subset is shrinking. There's no doubt about it. The fact of the matter is most of the patients that I was operating on, certainly in the US and back here as well, they're patients that have not had the benefit of these technologies, and therefore, their creases are deeper. They haven't had Botox at all, or only for the last few years. Filler's not that helpful in that age group, and therefore, they've got quite significant gelling. They've got heavy necks, and that requires more than what threads can provide. I mean, one thing we do here is we call a spade a spade. We're not going to try and sell, a thread treatment to someone who clearly does require a surgical lift, and that's what I offer. But yes, it is shrinking.
Yeah. So, Dr. Bao, what would be the typical age group or the typical presentations that you think would be suitable for this thread lifting?
I think there's two ways to go about it. It's from a lifting and an aging perspective. The ideal patient would be someone in their mid-30s who are starting to see the signs of a little bit of sagging, a little bit of laxity in the skin, and who want to sort of keep, who aren't ready just yet for a full surgical facelift. I think in terms of these kinds of patients, mid-30s to mid-40s, and I would even stretch it to mid-50s for some skin types such as Asians and East Indians who have just thicker skin. You can get a great result if it's just one area that's bothering you. Having said that, I do know that in the Asian market, particularly with this desire to have this V look down here, you do get a very great result just from an augmentation perspective as opposed to just a rejuvenation perspective.
Awesome. Okay. Well, thank you both, Dr. Bao and Dr. Pincock, for joining us and talking to us about your point of view with thread lifting.
My pleasure.
Pleasure.
Thank you.